You don't understand methamphetamine and the different psychological impacts it has on the body and on the brain. Since it's come to our understanding that you do not have the proper info and the studies in order to inform the audience without giving them misinformation. We will discuss meth and the effects on the body and the brain and drug tolerance, treatments, and resistance.
Methamphetamine causes multiple changes in the subject's brain and body. The addictive rush comes from the brain releasing large amounts of the chemical dopamine. Dopamine is a neurotransmitter that is associated with the learning and reward centers in the brain. The large release of dopamine causes a euphoric feeling in the subject. The use of methamphetamine causes significant change in the same reward centers by damaging the neurons and nerve protecting protein called BDNF. BDNF, also known as the brain-derived neurotrophic factor, is involved in a variety of tasks within the brain. It protects nerve cells within the brain while they grow, helps them reach maturity, and assures the nerve cells remain in good working condition. BDNF also serves a significant role in allowing the brain to make the necessary physical and chemical changes for learning new information and storing that information into memory. Some side effects of this damage are insomnia, hallucinations, paranoia, anxiety, confusion, lack of appetite, and possibly convulsions, which can lead to death. Long-term consequences of methamphetamine's impact on brain health include memory impairment, memory loss, a reduced ability to think clearly or logically, a reduced ability to maintain focus and attention, and a reduced ability to regulate violent or aggressive urges. This damage is not only limited to the brain. Use of methamphetamine can cause damage to the heart's blood vessels, the liver, kidneys, lungs, teeth, resulting in severe tooth decay, and any complications that arise from the method of intake. The damage to blood vessels can cause a wide array of complications, including arrhythmia, also known as abnormal heartbeat, and strokes, either of which may lead to death. Possible complications from intake method may include lung damage if smoked, abscesses or disease transmission if injected, and damage to the tissues in the nose if snorted. Usually due to the reduced appetite, malnutrition and extreme weight loss can also be factors.
Tolerance is a characteristic by a need for a larger dose of medication to maintain an original effect. The body builds a tolerance to the drug over time. This leads to an increase of dose, or it has to be taken more often in order to feel the same effect. Drug tolerance can involve both psychological drug tolerance and physiological factors. How strongly they feel the effects of meth and how long they last depends on several factors: the individual physical and psychological characteristics, the user environment, how the drug is taken, the quality and the purity of the drug, and if it's combined with any other drug. A significant factor is called conditional compensatory response. This is where the body prepares itself to expel the drug based on cues. For example, if you take the drug at your friend's house and then you take it at your house, you're more likely to overdose.
For the treatments, we're going to focus on the matrix model. The matrix model provides a framework for treatment of stimulant abuse and abstinence treatment after. Patients are taught about the issues critical to addiction and relapse. They receive direction and support from a therapist and are familiarized with various self-help programs. This treatment method also involves drug monitoring via urine testing of the patient. The therapist in this situation plays a critical role within this treatment model. They must encourage and foster a positive and encouraging relationship with the patient and use that relationship to promote a positive behavioral change. The therapist conducts treatment sessions in a way that promotes patient self-esteem, dignity, and self-worth. And the therapist does this by being direct but not confrontational with the patient. The matrix model contains elements from multiple treatment approaches. For example, it includes family education groups, early recovery skill groups, relapse prevention groups, combined sessions, urine tests, 12-step programs, relapse analysis, and social support groups. By combining multiple approaches, this model shows statistically significant reductions in drug use, improvement in psychological health, and reduced risky behavior associated with HIV transmissions.
Methamphetamine is a difficult drug to treat because it is an addictive drug and users may be resistant to change because of certain cues or relapse triggers. These cues have a powerful impact on addiction because it can cause a relapse since the brain links these cues to the action. An example of these cues is if a meth user smokes in their car, the car and meth form a paired association. The car is the conditioning stimulus, which isn't important alone, but paired with something that, such as meth, it can cause cravings. The meth is the unconditioned stimulus, which produces cravings naturally, which is this. And like mentioned before, when the conditioned stimulus and unconditioned stimulus are paired, it forms cravings or conditioned response. So every time the meth user goes into his car, it would trigger the craving response. This will happen in any environment where the addict smoked meth. So it could be his car, or it could be a house, or anything. The reaction could also occur with people he or she smoked with. This is why it is recommended to keep away from possible triggers for addicts who are attempting to get clean or quit meth, in other words. This is easier said than done though, because it's kind of less likely to sell your car and use a different one, which is why it's so difficult to be able to quit methamphetamine. It's a lot easier to just go back to it.